So we are in the body still, looking at the pancreatic duct, and Nadim's going to demonstrate for you the duct going towards the body tail. So this is obviously our pancreatic duct. So go clockwise and you will see the duct going towards. There's the splenic artery, splenic vein, pancreatic duct, and we're following it clockwise towards the tail of the pancreas. And as we do that, the right kidney comes into view. Keep going clockwise. And again, if it's getting away from you, you have to push in a bit to get close to it. So there you go. And now there. Now it's there. So we seem to be losing it there. I don't know if we're compressing it or if that's the end. But I think if you keep, this is your pancreas still. So that's your duct. So keep going clockwise. Keep going clockwise. There's your pancreas. Push in a bit because it's getting away from you. Okay, that might be it because this now is spleen in the back. So now now that we've done that, convert your image to, actually go back counterclockwise. Follow your pancreatic duct. I'm going to just for 1 minute actually go down because I want to see what goes on here. So this is your pancreas, that's your kidney. Now go counter, so you're going towards the the head and neck. So there's PD coming up, slightly dilated duct, minimally prominent. Again, splenic artery, splenic vein, and there's the pancreatic duct dipping down towards the head. So now if you advance and go clockwise, you should be able to follow just like a minimal advancement and now go clockwise, and you should be able to potentially follow the pancreatic duct this way. It doesn't always work, but it sometimes does. But this may be the extent of what we see from this part of the stomach. So I think in the interest of time, what I would suggest is endoscopic view kar dein zara. Let's go to the bulb of the bulb, yeah. So again, you have to have good endoscopic visualization, so make sure you distend. And it's like ERCP that. So maybe pull back first and just distend to see where we're going. Pull back. There. Now, there you go. Now advance the scope. That's it. Now you can see that there is something like on the left that is putting a pull back a bit for a second. There's an impression on the gastric lumen from the left, big wheel towards you. So that may be a distended gallbladder that's pushing down. If you wanted to look at it, you could put your probe up against it. So big wheel up towards you, and that may be gallbladder. But if you'd rather just get into the bulb, that's fine too. There. So now you're through, and you're in the bulb, and you actually have your bulb view. Can we switch over? इसको कर दें ज़रा ultrasound पे कर दें. So now you start seeing cross-sectional images of circular structures. This may be your dilated bile duct. So keep this in view, suction a bit to get rid of this air, and now go counter towards the liver. So when you go counter, you're going towards liver. So that's your gallbladder. This may be the cystic duct because it's communicating with the gallbladder, and you're starting to see liver. Now go clockwise, and this is your main common bile duct coming into view. Keep going clockwise. Now suction and go. So right hand has to be relaxed and just supporting this. And now with your left hand, raise your left hand to go clockwise. There's your common bile duct. And as you go clockwise, you're following it towards the head of the pancreas. Keep going, keep going. And it's moving away from you in this one. With practice, you can figure out what maneuvers it takes to keep it in view, but here you have to, again, if it's on this side of your probe, if it's to the right of your probe, you have to pull your scope back to bring it into view. to pull the scope back towards you. And in this case, we've gone too far over, we're seeing the right kidney. So that's okay, but you get a sense that the bile duct is dilated, right? So let's endo kar dein वापस. Let's go back to the second portion now and work our way backwards. So the ERCP की तरह होगा कि you have to go through the second portion. Elevator will be a big wheel towards you. Or push करने की से ज़्यादा अगर once you're around the turn, you may actually want to start reducing. Small wheel अपने right की तरफ करें. And then maybe like you do in endoscopy and ERCP, thumb down, so big wheel towards you, or gently reduce the scope to pull towards you. I think you'll go. Make sure your thumb is all the way down. There you go. Or pull towards you. So thumb down, like remember it's like an ERCP, so yeah, thumb down. But I would actually reduce right now. I wouldn't advance. नहीं. You can, ठीक है, let's try again. Here and then thumb down, small wheel to the right, and big wheel towards you. And now try pulling. You almost, yep, you got it. Very good. Cut पे जाएं. नहीं lock नहीं करना. Just reduce. Pull towards you. The anatomy may be altered. Let me try. एक तो ये कि मैंने I just wanted to demonstrate कि you can look at ultrasound करें on ज़रा कि ये आपका gallbladder. You can look at the gallbladder. You see that bulge? इसको बड़ा कर दें. So you can see layering sludge in the gallbladder from the gastric antrum. So that's one thing. दूसरा ये कि again just going through जो आपका view था, basically bile duct which has sludge in it. You can see layering sludge in that. And as I go clockwise, we're following it towards the papilla. और ये actually, yeah, this thing, it's the gain का है भी. ये अब आपको नज़र आ रहा है कि this is your mass lesion here. So as I go clockwise, it becomes more obvious, and this is actually pancreatic duct running. This is pancreatic duct running right through it. So this is the PD bile duct all the way to the ampulla, and as I go counter, और इतनी fluidity हो जाती है once you get practice कि I'm doing it with one hand. My right hand isn't even on the scope. I can go all the way to liver, and then as I go clockwise, I can follow it to pancreas. I just have to pull back a bit, or thumb down, और ये उधर को all the way down चला गया है to the duodenum. There you can see the duodenal lumen right there. So to get into second portion, of course there may be compression. So thumb down, small wheel to the right, suction, और ERCP की तरह I have my thumb down क्योंकि ताकि मेरा जो probe है doesn't go through the back wall, and I'm just going to gently pull my scope back. It's a very prominent papilla, which could be ampullary lesion as well. तो endoscopic view ज़रा बड़ा कर देंगे. So I think इनकी जो anatomy है वो deform हुई है because of the tumor. So that's why you were having a hard time. He's probably developing duodenal outlet obstruction, but it's hard to say. So we're not necessarily below the ampullary orifice. I think at best our ultrasound scope will be at the ampullary orifice. So right here, I'm going to do it. What I'm going to do is thumb down again to get apposition against the ampulla. Ultrasound कर दें. और मेरा ये होता है कि for stability, हाँ जी, it's still unlocked for now. You can sometimes lock it, but right now always start unlocked. For ये unstable है. So as I go clockwise, it makes me more stable. तो मेरा ये tendency होती है in ultrasound that for second portion I actually turn this way. That stabilizes me, and then I reduce some more. और उसके बाद my right hand is supporting my scope, and my left hand is doing counter and clockwise. And as I do that, I do my obtain my views in the second portion. We're going to zoom in one. और ये अब we're looking at mesenteric vessels, and there's the mass. Oh yeah, this is probably an unsnit mass. Right there. So Dr. Saad, is this something that needs to be sampled, or what's our, like, this is a, what is our plan here?
So I don't know, they are all left, so maybe I think we need to sample. It looks like a pancreatic mass which is involving ampulla.
Exactly, that's exactly.
Yeah, so I think if they haven't sampled it, we should.
Yes. I just need, direction on what needs to be done.
So
here.
I think somebody should be there. We can ask them.
Okay.
Is the resident there?
क्या इरादा क्या जी इससे do we need to
Do we need to sample that? It's a pancreatic mass involving
तो
ampulla.
in measurements पे आप लिख लीजिएगा 4 by 2.9 centimeters. ठीक है?
Yeah. So we can sample it.
ठीक है. और ये by the way, these are the mesenteric vessels below it, the SMV and A.
Yeah.
So,
So usually SMV is closer to the pancreas,
Exactly.
and SMA is a little farther.
absolutely.
So here,
This is A. This is A, and you can see the slightly thicker wall on it too. And Khalid, you're absolutely right. I'll just show you the V as well.
yes.
So this
That-
is A with a thicker wall, and as I go more clockwise, this is the V which is closer. So V, A.
So A and
A,
B right
A
there.
and V, and the V is coming into the confluence to the right
Mhm.
here. It's joining to form the confluence. And here we see this large mass with what you'll see is the pancreatic duct right there. And then as we go more counter, you see the bile duct. So bile duct dilated with debris in it. And as I go more clockwise, you can see the pancreatic duct is involved too. It's not significantly obstructed. We know that from the body image that the duct was not markedly dilated. But it's going to eventually be involved and get obstructed. So this is the bile duct again, and this is the pancreatic duct. And if I keep going clockwise, I get to the mass, which tells me that if I'm going clockwise, I'm going more anterior, which tells me this is an unsnit mass. So this is a mass in the pancreatic unsnit process, PD bile duct, right there. So to biopsy, we want to try and stay away from the pancreatic duct, and we're going to basically pushing a bit.
It's 1 and 2. It's
Yeah, and so get a needle in and biopsy. Needle दे दें अगर 22 और यहाँ से needle आएगी. So this point tells us that the needle is going to come from this side.
So
This is towards the shaft. This is towards the feet.
So I think we will have to move on.
Yes.
So can we do a quick FNA, please?
Yes, go ahead and I've asked for the needle. So for this, a couple of things you can do always. Wherever you're planning on sampling, you can look for vessels. Tiny vessels like this are not of concern. The other thing you want to try and avoid is puncturing either of the ducts. You can't see it? और आप लोग क्या स्लो पुल करते हैं या सेक्शन? एलिवेटर बंद है और अल्ट्रा फॉर द EUS scope the stylet has to be around 1.5 to 2. एक सेकंड वेट करें. अब you can see the needle right at the tip here. So I'm going to advance this stylet a bit more. Yeah. Now you can see the needle much clearer. I'm going to get rid of the cursor. And I'm going to just back away with my image to see where my lesion is again. So this is one area where, because I need a lot of thumb down flexion, I will actually lock my my big wheel. And for sampling, if you can get the periphery is better because you'll have less necrosis. But what we're going to do is, I think this is a reasonably good position to get the lesion. You can see the tip of the needle. आप stylet pull करेंगे या section?
अगर आप सेक्शन चाहिए तो मैं आपको
नहीं, जैसा आप कहें, मुझे कोई फर्क नहीं पड़ता, बट ये कि फिर निकाल दें, फिर चलें stylet निकाल दें और section ले लें.
सेक्शन में
ठीक है? हाँ जी, नहीं ठहरे, ऑफ करें. So now I have my needle ready. I can see the tip of the needle coming out, and I'm going to do a nice firm jab like that. Once it's in, section on kar dein, and then up to maybe 15 to 18 back and forth passes, and you want to go fast. You can fan, you can change your angle.
उसको
बंद कर दें, and then you pull it back.
कैप लगाओगे मैं सर
जी. और जितनी देर हम वेट करते हैं, we can continue to evaluate. So basically, again ये है आपका lesion, ये है. It's hypoechoic compared to the rest of the pancreas. It's हाँ, ये it's possible that it's necrotic tissue. I don't know if it's like, because duodenal lumen तो इस तरफ है, so maybe that, or it's part of the duodenal lumen. It's hard for me to tell with certainty. और ये splenic vein है, and that's coming into the confluence here. It does look like there's air in the lesion. Or we saw it from the bulbs, it can be sampled from the bulb as well. हाँ जी. आप लोगों का क्या प्रोटोकॉल होता है? 2-3 पास कितने करते हैं? 3 पास. सही है. तो वो कैसे, और ये लिम्फ,
कंफर्म हो गया इससे आप
अच्छा है ऑन साइट हैं. अच्छा, और ये लिम्फ नोड है, दिस इज लिम्फ नोड, पेरिपेंक्रेटिक लिम्फ नोड.
स्लाइड भी आपको चेक करके बता देंगे तो उसमें
कर दें चाहिए, बट ऑन ना कीजिए. ठीक है. यस, स्टार्ट. बंद कर. Yes. So. So yeah, this is the bile duct. अगर मैं, if I keep going counter, I will go towards the liver, and you may be able to follow the bile duct all the way up into the hilum. So वो cystic duct है below it. And now we're in the hilum. Gallbladder आ गया. Now I'm going clockwise. Bile duct. We lose the bile duct in the area of the lesion. And now I've fallen back into the stomach. But yeah, there is hyperechoic material inside of it, which I agree with you is consistent with necrosis. दूसरे कि while we wait, we should look at the liver for liver lesions because that obviously would upstage the lesion. ये this is concerning. ये lymph node जो है. Sure. ठीक है. ये porta hepatis node है जो कि it could be either or, benign or malignant. Endoscopically it's secondary. और ultrasound could be. Thank you. So again I'm doing a lot of thumb down. ठीक है. So I'm flexing into it a lot. अच्छा. अच्छा. Sure. तो ये नील नज़र आ गई. ये लीजन आ गई. अब मैं थंब भी डाउन कर रहा हूँ और एलिवेटर भी. I'm maximizing my downward movement. It also gives you stability and angle towards the mass. उसके बाद unlock किया. थोड़ा सा it's a bit maybe too close to the periphery, but हाँ जी on कर दिया.
Because we got enough cells.
Oh,
Okay.
so let me do the third.
So you just need to send some sample for the
Sure.
cell blocking.
So I think you'll need an ERCP साथ है. ये लॉक करो. उनको बता देंगे.
We'll try and do it towards the end of the day.
Oh yeah, not right. No urgency. No urgency. अच्छा, what I want you to do is I want you to get a sense for this. I'm going to get you to second portion, and I want you to just. Oh sorry, cap दे दें यार. वो लगा दी, sorry. I think we're still in second portion. What I would like you to do is ये mass है. Thumb down. ये body position maintain करें मेरी तरफ. You're facing this corner. मैं अपने fellows को ये कहता हूँ कि तुमने उस तरफ नहीं देखना, इधर को देखो. And then support with your hand, left hand, right hand, और ऐसे करके clockwise, counter, and gently pull करना है till you can identify the bile duct and pancreatic duct. इसमें obviously pancreatic duct आपको ये थोड़ा सा नज़र आता है, and bile duct is when you go more counter. So this maneuver, because this was not the ideal lesion for the second portion, try this. And you'll have to do a fair amount of thumb down. And now just, yeah.
Pull back.
And go counter with your wrist, wrist. There you go. And then pull back just to bring it into the center. Pull back some more. Now go clockwise and counter. So you have to do this constant movement back and forth. Clockwise, that's your necrotic mass, pancreatic duct, going duodenum, that's duodenal wall. Now go counter, and you should see, if you don't see bile duct, that's bile duct, this right at the top. That means now go back clockwise because it will stabilize you. And now pull back a bit more. Pull back a bit more, tiny bit more. Now go counter. And this time you should see, keep your thumb down. You should see bile duct some more. Your thumb is down, right? Okay, good. Now go clockwise again. So keep doing that till you have better views, right? That's the idea. So now that means you need to pull back some more because you're not getting that ideal view of the bile duct quite yet. So pull back some more. I think what happened was you actually ended up reducing more as you did that because I wasn't fully reduced. So now go counter. There's bile duct. Now go clockwise. Now one choice is you can pull back a tiny bit now. And now go clockwise.
Mustafa?
You can switch over, sorry. Yes?
Yeah, we are just going to go for lunch.
Oh, sure.
So you guys can come and join us.
Sure.
Okay. If you want.
Yeah, yes. Thank you.
We'll have lunch served
Clockwise.
here. So all the
We'll be done in like 60
Okay.
seconds. I'll come out there. Clockwise. That's your rest. Now pull back. Pull back. Now go counter. Mass. Keep going counter. Pancreatic duct. Keep going counter. Bile duct. See that? And now if you follow bile duct all the way counter, you will get towards liver. So that's it. Pull back some more. That's the idea. You do gentle pull back and you keep repeating this. You're basically sweeping against the medial wall of the duodenum. Now go counter. Pancreatic duct, keep going counter. Keep going. Bile duct. So that's it. Now pull back. Here, let me just show you. Pull back. Counter towards liver. Clockwise towards lesion. But I know you're being tentative, which is totally reasonable when you're starting out. But as you get more and more practice, you just do this faster, right? Take it. Huh? That's nice. You got the body views were great. I mean the stomach views. So चने पे निकाल लें because we don't want to unnecessarily delay the case. I did not see anything obvious in the liver on my limited exam. Yeah, you just followed the PDF, by the way. That was nice. And that's going into the head. Now if you go clockwise, you'll follow it towards the body tail. So pull back. There you go. Excellent. You're following it. Keep following it. That's it. Keep going. It's up there. ठीक है चलिए निकालना है